Dr. Justin Mirville.
What's up,
Welcome to the podcast.
Hey, thank you for having me on, James. How supportive they were. Like they always made sure that, understanding the value of an education as something to really like. I said my parents didn't know too much about how to really get me there. Residency is a whole different beast. I'll tell you that, because I think you have to give yourself that grace, or it will really wear you out. Especially, like I said, as person of color, man, black man, like when people already maybe are a little bit colder to you, not intentionally, but again, there are a lot of external reasons, right? Maybe they have not interacted with a lot of folks that look like me, and that's for systematic reasons,
You tried like a couple 24s pretty recently, so I'm interested to hear what some of those hours are like.
So yeah, I think most people realize residency is.
Hey, my name is James Charpentier, and welcome to Less Than 3%, where we talk about healthcare, my journey becoming a physician, and really anything from the perspective of a black male pursuing medicine. And in this episode, I have what I think is going to be a really interesting episode, so definitely make sure you guys stay tuned. Before I introduce the person that I'm going to introduce to the podcast today, if you're listening on Spotify, Apple Music, wherever, go ahead and make sure to give it a follow. If you're watching this podcast on YouTube, definitely make sure that you subscribe, hit notifications, share it with other people if you enjoyed it and you think they would learn a lot from the episode. Now that being said, let's get into the podcast. The guest on this episode, he is a son of Haitian immigrants outside of Atlanta. He completed high school at Valley Stream Central, a school in Long Island. He graduated as a Noble Student Athlete with D1 offers, but ultimately, in his transition to medicine, he graduated the CUNY School of Medicine as a part of the class of 2023. He was also a recipient of multiple scholarships, including the Dean's Award for Academic and Clinical Excellence. He's now a PGY2 in internal medicine at Montefiore Medical Center, Albert Einstein College of Medicine. In this episode, I'm pleased to introduce Dr. Justin Mirville.
What's up,
Welcome to the podcast.
Hey, thank you for having me on, James. Pleasure to be here.
Yeah, thanks for agreeing to come on the podcast, because I already know I have a busy residency schedule and everything.
Yeah, life is busy, but again, it's cool to talk about something that I think we all, you and I share. So I think I'm excited to get into it.
Yes. So I know I gave a bit of an introduction, but would you mind giving everybody listening to the podcast an introduction to who you are?
Yeah. So I'm glad that we kind of started with the fact that I am a son of Haitian immigrants. I think that's really integral to my story because I think I've been aware of just like need and lack in this world because Haiti is a place that for all its struggles we still try to find a way to persevere and whatnot. So I feel like I've just been very sensitive to the needs of people from very early on, and I feel like that kind of propelled me into my sort of journey into medicine in the first place. Luckily enough, I did have somebody early on in my life too, in the form of my uncle-in-law, who was a doctor as well. So that kind of culminated into sort of the path of medicine, right? I wanted to take care of folks, and I did have a sort of an anchor in the sense of my uncle to get me to where I am, I guess. But yeah, man, I wanted to be a really well-rounded person. I was really interested in the sciences, and I was lucky enough to find Sophie Davis. So I'm thankful. I'm happy to have been there and to kind of completed that journey. But that's a little bit about me. I like to do a lot of different things, and hopefully we can get more into it. So yeah, it's my little spiel.
Yeah, so I appreciate that. I think you already answered a little bit of the first thing I wanted to ask you. But I think it's great that, number one, you just talked about like how your background, even just thinking about like where you're from and what that kind of means, even in terms of like Haiti specifically, and then kind of how the tie with that and like your family kind of starts to pour into like the interest in medicine.
Yeah.
I want to maybe like expand on some of the things that I guess help like propel you to the point of actually going towards being a doctor.
Yeah, so I think a lot of folks, again, especially folks there's like this sort of cliche immigrant mentality sort of thing. It was like, oh, the doctor, lawyer, engineer kind of like trope. So again, I think that is true for me in a lot of ways. Like my parents did kind of make sure that was like always a viable option in my mind.
Mm-hmm.
But for me, even like I think I am sort of like a very logical or practical person. So again, it just sort of aligned with like my interests. Like those were kind of synergistic sort of things for me. But like I said, even for me personally, like I do see myself as like a very sensitive person or like an empath. So that was, those two things kind of coincided in me kind of really pursuing or staking my interest in medicine basically. And along the way, like in high school, I think, like I said, transitioning from like Atlanta, where again it was just a vague drive to do better, and then in high school really starting to excel and finding a real interest in biology, the life sciences, and then again sort of seeing Sophie Davis as like a true option outside of maybe a more like vague path. Which again, there's pros and cons to that, but I felt like by the time I was in high school, like um, the way I had seen the world, like I knew like I did want to really make an impact and really, yeah, just do better for others. Like I did want to also support my family and other people around me, so I felt like at the time, like I knew that was the way I kind of wanted to, yeah, just do. That's what I wanted to. I figured out what I wanted to do in my life, basically at that age. So yeah, if that answers your question.
Oh yeah, for sure. No, I think there's definitely a lot there.
Yeah, no, we can unpack that for sure.
Yeah, there probably some things I also asked about even more. One thing I do want to focus on for sure is what was that actual path like for you when it came to going through undergrad and then ultimately going through the rigors of med school? Because you had all those things like from your background kind of pushing you forward. What kind of like how do you navigate actually getting
so
med school?
Honestly, I think a lot of that did fall on my shoulders because my parents, again, for how supportive they were, like they always made sure that, understanding the value of an education as something to really like, help me to get forward in life, because unfortunately, like my family, we didn't come from the most financially stable background. So again, I knew that was paramount, or I knew that was like a way to, again, like I said, support myself, support my family. So that was something that I knew would drive me forward. But unfortunately, like I said, my parents didn't know too much about how to really get me there. So a lot of the onus did fall onto me, and the sort of mentality that I had was, like I can do what I can to prepare myself, right? I always knew that I wanted to do well in school, so I just did it to do it at the time until, again, like come college, like application times and stuff like that, I was looking around, and honestly, Sophie Davis was the place to me that seemed like it would really view me, again, like their application policy, even being like a holistic sort of review, that kind of really jived with who I was already. Like I said, I saw myself as a very well-rounded person. Like I loved doing athletics, like all of that stuff. I felt like I knew I wanted to do the best that I could do, just period, right? And then on top of that, I just happened to be in a decent position to actually apply myself. So when I did get the opportunity to really kind of put myself out there, right? They do want to see a lot from you. I was very interested in them because they did want to see like who you really were as a person. So that was, again, an abbreviated sort of path to getting to Sophie Davis. But on top of that, once I did, it wasn't necessarily too much of, like, in hindsight, everything's 2020 in hindsight looking back on it, but I did everything I could do, honestly, to prepare myself to get here, which I'm really proud of, and looking back. But a lot of it, unfortunately, did fall onto me. But again, I did have the mentality that they gave me, right? A lot of mistakes I did make, but a lot of things I just knew, like, like I was very determined to continue to try to move forward. So once I got to Sophie Davis, The undergraduate portion was a little bit different because, like I said, I had done a lot, but at the same time, I didn't necessarily have all the tools that I might have wanted or needed at the time. I had to learn how to actually study. I didn't know how to do that. I didn't really know how to organize myself, organize my time. I had to teach myself structure. And again, that did not come easily either, right? That's still, even now, I'm learning that in a different sort of way. But I remember my first year, like, things were okay. The first semester I had fun. I was still able to get by without much of a headache. But again, chemistry was definitely like a time of like trials and tribulations, man. That's really when I first I realized like like the way I was doing things is not gonna play out well for me, honestly. Like, studying was a real thing, and like I said, I was determined to figure it out. I had great people, a great place where you can definitely like learn from each other. But even in med school, like, it was just a process, right? You continue to sort of refine what you've learned, and I felt like that's what I was continually trying to do, right? Like studying and like learning became my craft, and like I kind of fell in love with it in that way. So yeah, like a lot of it was approach and mindset, right? I didn't always have the tools, but like I said from the beginning, like, that's one thing I can say my parents instilled in me, was the drive and like a determination to continue to move forward and do better. And I still have that to this day. So again, I'm very happy to say that, you know, despite not having all the tools, like I had what really mattered at the end of the day. So yeah. No, that's not everything, but I think that's like some big points there.
Yeah, I think one key thing about what you said there, and I think this is probably relatable for probably any medical student, is like really having that drive and that determination to kind of figure things out and make those adjustments or those changes that you need to make. Because that's really, I think, probably one of the most key things that gets you through med school, because like you're constantly going to get a bunch of different stuff thrown at you, but if you kind of have that mindset of knowing how to kind of move with that and find ways to be successful, ultimately that's kind of, I think, how you end up getting through all of that.
Exactly. Like, there's always going to be like twists and turns, bumps, setbacks on the journey, but it's always about getting back up and just trying to learn from your mistakes. It's like failure is not a destination necessarily. It's still a lesson to be learned. So,
yeah. I think also going a little bit further on that point, what do you feel like are probably some of the most important lessons you learned, especially like during your time in medical school?
I think some of those lessons were really learned when I would say like consistency is really key. It like Rome was not built in a day or something. Like, I like that saying. Or just just having to really showing up is half the battle, or just like that self-talk you have, like really managing that for me was super important, because again, it can get overwhelming, especially in Sophie David for 7 years. It's like, wow, like, it can be hard when you're in the middle of it, or like you're having a hard day. Or I remember for me, like, studying with Anki was very, very tough, and I know that's one of the best resources we kind of do have at times, but it's like a double-edged sword, because again, you're able to retain a lot of information, but it's also a lot of work to show up and to consistently be like actively learning, right? Day after day. So I think, again, just really being aware of your own self-talk and trying to be very intentional about how you start maybe your weeks, your months, and again, not letting little setbacks really turn into spirals, right? So I think that was very important for me. And like I said, just giving yourself some grace when the days aren't so tough, or not tough, but like just taking what you can and being very present. It's very hard, but I think that's essential. It's essential.
So I'm a little curious about this then. So I know you've talked quite a lot about some of the things we're able to reflect on in terms of like getting through medical school and the path and everything. Do you feel like some of those lessons and some of that mindset that you've had has kind of carried with you into like actually going through like residency and like actually working as a doctor? in the room?
Absolutely, man. Like I was, again, these little, oof. Residency is a whole different beast. I'll tell you that. Because I think, especially in med school, like I felt like when, like M1, M2, it feels like you can really start to get into a rhythm with things. Or like I said, once you kind of learn how to study, it feels like a lot of that stuff I could just bring over from, like the general principles I could just bring over from one class or one organ system to another. But in residency, a lot of that stuff gets thrown out the window, man. Like, and
that's interesting.
Yeah, you're put in a lot of situations where, again, you don't know, and I think, again, as a black person in medicine, like a lot of things just come a little bit harder. There's a lot more friction with maybe getting some of those, like those little tips, those little pointers about like how to like smoothen out the process, or maybe like how like this thing should go, just because, again, a lot of residency is like a lot of unwritten rules. It's like a hidden curriculum almost. Like things are expected of you, like you will learn, but you gotta really roll with the punches. And again, the same way like you're doing your question banks, man, you got to get through how many thousands of questions at some point or something. Like, you're not going to get 100%, or even like maybe, from high school or even like undergrad, you're used to seeing like a certain percentile, right? Maybe it's like, I don't know, most people are comfortable getting A's and B's at certain points, but like you're not getting no 99%, no 95%, something like that. It's like, but again, it's like the mentality of like, this is not, it's not a reflection of who you are or like your knowledge. It's literally a tool to help you understand the gaps in your knowledge. And I feel like, again, the mistakes you make in residency are the same thing. You're in training as a doctor. You're in this position now. You're allowed to make mistakes because you're under somebody else's license at the end of the day, right? Yeah. And that's for a reason. Like, you're doing this with training wheels. People know that, and unfortunately, like, it may not always feel that way. And it's different because, you are like the person who's acting and speaking and doing the things of a doctor, and you are a doctor, right? But it's just very different because it's like it's both of those things, right? You are that person who is more responsible, but at the same time, like, you're in this position and people know you're going to make mistakes. So very similarly in this, very similar to med school, I feel like you're going to make mistakes and you have to learn from them. That's a principle of life, no matter where you go, honestly. But it just feels very different, and the context is very different, and obviously the expectations are different. But I don't think really like you have to give yourself that grace, or it will really wear you out. Especially, like I said, as a person of color, man, black man, like. Unfortunately, like, I have not really had the opportunity to see folks like me very often at all in the hospital. So, that level of comfort is not really going to be there, and you have to learn how to reassure yourself a lot of times, man. And that's tough, especially, we're younger than a lot of other folks too. So, that confidence or that self-assuredness won't come as quickly, I feel like, but the end of the day, you gotta still believe in yourself.
I would definitely imagine, obviously I haven't been in the shoes of a resident yet, but I would imagine, especially how like hierarchical I would imagine some of that stuff is. I'm sure there's probably like a couple potential biases that can kind of come up that you deal with at times, or if I had to guess.
So again, I was using the word friction. You can call it a platitude, euphemism, whatever, but like a lot of things that may come easily through, like, like building rapport, like same way with the patient, like the closer you are with somebody, the easier it is to exchange information. And again, when there are barriers to, when people already maybe are a little bit colder to you, not intentionally, but again, there are a lot of external reasons, right? Maybe they have not interacted with a lot of folks that look like me, and that's for systematic reasons, So then when there's this constant in-group and out-group kind of deal, this is a fact of psychology almost. Like, you're just going to empathize less with this person. You're going to put you're going to think about their perspective less, or even the details of their life less. You can call it a bias, and it's, we know this does show up, right? We know black women are dying, and like I don't think that's necessarily a mystery either. But like I think that is that's definitely there's it's not too much of a mystery as of why that's happening in my eyes.
Okay. So in that case, like given, I guess some of the obstacles you probably feel like you face in senses like when, I guess you're dealing with, I don't know, either like other residents or different people that you're working with, how have you kind of been able to maintain a sense of not only confidence, but being able to kind of show up and like really work to like the best of your ability with a lot of the people that are like around you?
I mean, I think, I'm really happy to say that I do have like a village of people around me, right?
Mm-hmm.
Like I have a very loving family, and like a really great group of friends, my cousins, like I love them to death, right? And when I am feeling down, like those are the people that I can lean on, right? Or when I am having a bad day, like I can call my mom and talk about how things have been rough, and I can really lay that down sometimes and sort of allow them to pour into me. But even when I'm able to extend myself to somebody in the hospital, and I can see like what my impact does for somebody, to be somebody for someone, and reflect on that, like I think gratitude is definitely something that has carried me through a lot of school.
Mm-hmm.
And even now, reflecting on like what it means to do what we're doing, like I said, I got into this to take care of people, and like I really have. I'm able to see like sometimes like my freaking clinic patients, sometimes like I'll see them in the deli and it's like, yo, that's my doctor. I'm like, that's crazy. And it's like, it's cool to see like how enthusiastic sometimes people can really be about just a caring face, or somebody that knows that they really do have their best interests sometimes. So yeah, that's what that helps me a lot.
Yeah, so that kind of takes me to something else I'm curious about. So what do you feel like, because I know you mentioned like even seeing patients, like clinic patients or like the deli and stuff, what has probably been some of the most memorable sort of experiences you've had like with patients being a doctor?
So it is sometimes in clinic, but one time I did I had a gentleman, it's like one of my first like my first clinic block for sure, second clinic block maybe. I had referred a guy for like a just annual like it's like a CT chest for like lung screening, right?
Okay. Yeah.
And he unfortunately, like I believe he had an NSTEMI that day.
Oh, okay.
So that was like, like a very scary thing, right? And he was in the CCU, he had a cabbage, like very extended hospital.
Oh yeah, that's a heart attack for anyone listening. Probably who doesn't know for sure. Yeah, just want to make sure.
Yeah, that was a little too technical, but yeah. So I sent this guy for a screening, heart attack, long stay in the hospital. I see him for like discharge follow up, and like the guy's convinced that I saved his life, and I'm like, I did not see that way, like did not see it that way at all. I'm like, they kind of just did the job. I'm like, that's indicated, like sending the dude over, and he's like, no, like he looked me in my eyes. I'm like, oh my God, like he's just, he's like, yo, you really saved my life. He's like, I don't know what I would have done that day. I wasn't feeling well. I probably would have stayed home. And I was like, it was just crazy to think that, the difference in perception, right? Like I really did not see myself as this kind of person, but now like in his mind, like that's solidified as who I am, and like it's still crazy to think about,
Yeah.
Or like I've had interactions with patients where like very sick woman with unfortunately cancer, and like I've been able to have just very real conversations with her while she was admitted, just taking care of her. And I remember one day just going in to say hi, be friendly, and I held her hand and we were just talking, and then at one point we just both said I love you, like, and it just felt very real, like, and it's very hard to explain that, but that's beautiful to know that, like, that I knew that meant more to her than almost anything we were doing at the time. And like, those are the memories that really stick with me, where I'm like, like, this is really why I do this. And it's again, it's for the people. I'm here to take care of human beings, and I'm glad to do the medicine as well. But I feel like, well, the medicine, that's inseparable, honestly, in my eyes. But yeah, those are like two things that really stick out to me, and it's crazy, man. It's a wild ride.
I think it's definitely interesting, like what you said there, because one thing I think about quite a lot is that sometimes I feel like in the midst of at least being, like a second year medical student, doing endless like practice questions and reading stuff and all this, sometimes I just think like, am I kind of like losing or almost kind of like forgetting like why, like, I'm doing what I'm doing? Because sometimes it's like I'm going through cases, I'm just like, this, like, I have to kind of remind myself, like, this isn't real life, like, this is just a case. And then it's like I hear stories like this where it's like there's a real sort of connection there between like a physician and a patient. And even the times where I've gotten to kind of be in clinical settings and interact with people, it's almost like a quick instant reminder, like, oh yeah, this is like why I'm trying to do what I'm doing. And so I'm always like inspired when I kind of feel inspired just like hearing that aspect.
No, I mean, I'm glad to even tell that, because again, I know that's in me, and I know a lot of people are still trying to make their way. And again, there's so much, like you said, there's so much like knowledge you're trying to accumulate, and there's so many scenarios, and you're trying to organize a lot of things, and on top of that, you're just tired, like you're grinding all the time, man. And I get it. And even in clinical scenarios, like, you're still trying to you're trying to perform, you're trying to do all these other things, right? And I get it, because to be a doctor is you're wearing a lot of different hats at the same time. So when you do get to a certain stage, like, I can see how sometimes folks do get a little bit distracted, or like can maybe lose the plot sometimes. But like, I'm really happy to share that, you know what I mean? Because I do know a lot of people did come to medicine for those sort of things, and like, it's great to get a reminder every now and then, and to even talk about that, to make that like sort of paramount, right? Make that the story. Because like, I still think of doctors as like healers, and to heal somebody is not just to dispense medicine. It's a lot of times people are coming, like, again, like, we take care of the mind, you're supposed to take care of the heart as well. And like, I mean that in a more like figurative sense, there's a cardiologist too, but like again, like, people are also looking for a little bit more than that, right? And you're like, a lot of us were capable of doing that. And again, as Black people, like, sometimes like we maybe don't get that little bit of extra care, or that extra bit of mindfulness that can honestly make a difference, as far as a patient maybe coming back, or somebody voicing something else that is actually on their mind, or that takes just a little bit more rapport to actually talk about. Again, whether that's a mental health thing, or maybe just something more, a little bit just taboo, or in their mind that they want to actually get addressed. But for one reason or another, that just has to sit with them, and nobody's there to maybe take care of that. So I'm happy to talk about it.
So then that brings me to something I also want to ask you about. Going off of that point, do you feel like there's ever been any times, whether that was like during medical school or even in residency, where you kind of got caught up in some like those other things of like trying to make sure you got the right evaluation or you got the right score and all of that? And then how'd you kind of like manage to keep that mindset of like you're really trying to care for people?
I mean, I definitely feel like there were periods where, like, I was sort of like debased, or like my focus was like fog, like clouded by again like just questions, hockey, like just the grind of having to just show up and perform, right? And again, that I think that's gonna happen to most people at some point, and like I think again talking and having again I had a great group of people that I did come up with, so I was able to talk and like kind of vent about some of my frustrations, and it was again, that's why I'm like, for all the pain that Sophie is, it's like, I really do love this place because again, you're here with a lot of people that are trying to do the same thing, and like I've got to see like their hearts, like I've seen them from young ages, and I've got to see glimpses of like even why they're here. So when I'm able to talk with other people who are like-minded, who I can actually trust, and again who are going through it with me, it's like that's a great feeling as well. And again, talking with the village that I have, seeing that, getting those reminders, people pouring into me those affirmations of again who I am. And again, sometimes I can get lost when sometimes it's literally like a lot of times you're kind of reduced to a number, like, or it's like an honors high fat, like that is very hard. And hopefully medicine is sort of changing and for the better, but yeah, just having having people in my life that actually are watching out for me and that I can confide in is really big. I don't think I would be, like I wouldn't be as present, or I wouldn't be in those situations that I talked about earlier if had I not had people willing to extend themselves for me.
Yeah. So I definitely appreciate you, mentioning that and kind of talking about that a lot, because I think that's something that I don't know if everyone is always aware of when they're thinking about like coming into the medical field, or kind of going on that path, is just how much of that is also you trying to balance a lot of academic aspects with trying to really do the thing that you came in aiming to do.
Yeah. It can be very difficult to sort of stay aligned because again, there's a lot of different. You're just being pulled in a lot of different directions, so it's understandable a lot of times.
Yeah. So I do have, I think, a couple more interesting questions in my opinion. I definitely don't think it would be right to have a resident doctor come onto the podcast, and not ask a little bit about residency.
Okay, let's talk about it.
There's definitely some things, I think a lot about when I think like my idea of what residency is like and stuff. And I recently got to have another PGY2 on the podcast, is able to talk about his experience and stuff. And so I do want to ask you, number one, I know the first thing, like we were talking about this when we were trying to like schedule having the podcast and stuff. And you mentioned you had like a couple 24s pretty recently. So I'm interested to hear like what some of those hours are like. And
so yeah, I think most people realize residency is tough, and there's no way around that. Like it is super duper long, and it will be stressful. But again, it's an opportunity to really finally do like the thing. I'm like a doctor, it's like, oh snap, I'm placing orders. I finally get to do stuff. But it's a huge learning curve. It's where do I even begin, man? But I guess, like I said, as PGY1, like as an intern, you're really just trying to figure out actually how to do the job of a doctor, right? I think as a med student, you kind of get the tools, but then you're really trying to put it all together. Like, how do I actually make an assessment of a patient, or even showing up day to day? Like, as a med student, like you're there, but again, those call shifts, those weekends, sometimes you're not there. Like that's a different sort of test. And again, like you're not just showing up to show up, like you're showing up and you're doing a lot of work. So just getting that together, and honestly for me, even like I was like a younger dude, and like I said, like even early through, like I think I was always somebody who, like, I liked to do the job and like I loved to learn, but like maybe like the professional foundations were not super tied down for me. And again, like I'm a young dude, like I didn't really know what a job like always was, or a career, I would say, right? Like I would show up in the hospital, blah blah blah, but again, to be an employee or to learn, like that's also a different sort of journey in and of itself. But yeah, that was really like my journey as a PGY1 in sort of a nutshell. Obviously a lot a lot gleamed over, but as a PGY2, it's also still it's still more of the same, but again, you're trying to now teach others how to do that job, or like you're taking on even more responsibility, right? So you're kind of understanding how to organize folks, but now, and again, this is from the purview of like an internal medicine doctor, but I'm also trying to keep it a little bit more general, because I think some of the principles still hold true, but like you're trying to put others in a position to do well, whether that's like making their own assessments or prompting them and trying to give feedback, which again, I love to teach. I realize like that's really the way that I can learn the best. Is I realize like laying it out and organizing it for others, helps me consolidate that information. But yeah, this is I guess more recently, like you were saying, the schedule has been a little interesting with the 24s.
Oh,
okay. So that's even like a newer level, right? Like I knew what it's like to show up for, like a 14 hour shift or something. But then it's a different level of preparation, right? Like I knew this block was coming up, right?
Yeah, okay.
I was thinking about this thing like 2 weeks out, man. I was like, how am I going to prepare for my first 24? And I will say that was definitely a grind. And like learning how to like time your sleep, and like again working with another intern or PGY1, and making sure again they're set up and they feel comfortable. But again, it's like a physically, like you're trying to balance so many things, right? Like trying to see when you can actually take some rest so that you're refreshed enough to again answer these questions, these pages, and stay on top of your patients. So it's a different kind of balancing act, and you still want to be able to, like I said, teach, but also you're still learning, and it's a very interesting balancing act. But like it's nice in the sense that I get 2 days off afterwards. I'll say that instead of maybe like a 7-day stretch or something. So
okay, yeah, got it. So I do also want to clarify again for anyone listening who doesn't know. So PGY 1 and 2 basically just postgraduate year 1 and 2. So just residency first year, second year. Yeah.
Thank you for
yeah, no problem. So one thing I definitely do want to ask, and especially for anyone who might not even know like what internal medicine is or what specialty it is, and also my own curiosity as well, like what does a normal shift for like an internal medicine doctor look like?
Okay, that's a good place to start. So for internal medicine, you can kind of think of it as, let's say somebody shows up to the emergency department. Well, even backtracking, there's inpatient and there's outpatient medicine. So inpatient is in the hospital, outpatient's usually clinic, or like you could think of it sort of like a primary care office, or like the GI doctor or the heart doctors, like outpatient clinics, right? And then inpatient side of internal medicine is when, let's say someone presents to the emergency department and you're not sick enough to get discharged home. You have to go upstairs and stay in the hospital basically, and you're not getting surgery. So those are basically like the two things that'll probably land you on a medicine floor. And we say floors basically. That's like the sort of term jargon that we use. So when you're on floors, it's typically like a sign out for most places, I believe, is at 7 a.m. So that's when the night team sort of switches with the day team. So then you'll hear about anything overnight for their patients, and then after that you'll kind of pre-round essentially. So you'll look through the labs, you'll talk to your patients, talk to the nurses, make sure that basically your folks are tidied up on the floor, right? any major issues, and then after that you'll have a sense of, right, everybody that you kind of are supposed to be aware of. So after that, as the first year resident, um, you'll talk with your attending, or you'll talk with your second year resident, your senior. And again, any urgent issues, we'll kind of smooth that out. We'll maybe do a little bit of teaching, and then usually around 8:30, 9 o'clock, they'll do like rounds with the attending. So then this is, again, a more formal, you can think of it even like a potentially academic sort of exercise where you are talking about your patients in a very structured manner. And again, I think this is helpful because you want to approach a lot of things with, a systematized way so you don't miss anything. And then from there, we talk about, again, pertinent problems. What's like the big problem? What's keeping this person in the hospital? How can we move their care forward? Or even like some social concerns that might be addressed later on in the morning, in the afternoon. And again, that's where me, as maybe the second year, my day, I'll go to like interdisciplinary rounds. So I'll talk with the social worker, I'll talk with the rest of the nurses, see what other issues, again, that are technically non-medical, that are still need to be addressed basically in the hospital, whether that's getting them some equipment, or if somebody's undomiciled or homeless, like helping them get their like shelter packet, or just getting them to the right place essentially. And then after that, we'll be talking to other team members, other consultants. Maybe this person does need a procedure, right? Or they need like a colonoscopy because they're potentially bleeding, or again like a surgery, or dialysis, something like that, right? We'll talk to the other doctors, and then a lot of that is in the afternoon, and then you'll have some teaching in the like a teaching session, maybe with. Not a teaching session. We call it didactics or lectures. So you have like a 1 hour lecture, I believe, at our program for like each month. Basically, we have a certain like subspecialty. So we'll have other doctors, subspecialists come in and they teach us.
Oh, that's cool.
Yeah. So then again, if you are keenly interested, like this is obviously a great time to do a little bit of networking and just solidify your learning a little bit more.
Yeah.
And then we do like some check-in rounds, and from there. Just try to tidy up any more tasks before like roughly 5 p.m. If you're a short call, and if you're a long call, is usually until like the night team comes in, and then you're kind of taking pages, or you're taking sign off from your short resident. So that's usually a day on the inpatient wards. I think that was pretty good.
Yeah, I think that was pretty solid. Yeah, definitely think that helped a lot of people.
Yeah. So then on the outpatient side, so you can think of this as clinic, right? Clinic is more your 9 to 5, and 8:30, 8 to 4, I would say usually, actually. And from here, so my role right now is like I'm functioning as a lot of folks' primary care doctor. So again, that one example of the gentleman who I was taking care of, who unfortunately, he did have the heart attack, but doing well now. So we're keeping up with them, right? And whether that's their routine screenings, or like let's say like somebody does have diabetes, and like let's say they require insulin or something like that, I'm seeing them very frequently. So like every 2 months I'm seeing someone to make sure that their diabetes is well controlled, or do they need to see like a different subspecialist, like maybe the foot doctor, or maybe they got to see the eye doctor to make sure those things are basically like a lot of chronic diseases, right? We're trying to make sure that they're optimized, and that like no complications or crazy sequelae, fancy word. Nothing like we're managing those things, right? And being proactive about their health essentially. So clinic is generally slower paced, and again, it's really cool to build rapport over some time with people. Like I really do enjoy a lot of my time in clinic, because I'm the type, I like to have fun with my patients, and I don't know, I'm always trying to laugh and smile with them. So it is really cool once you start to get to know people, and it just feels, again, like that's what I do love about medicine, is like I get to know somebody, and now it feels like I'm just talking to this person, and I'm just talking, I'm talking with them about life, and like obviously we're doing the medication stuff, but I just think that rapport building is so special in clinic. So
Yeah.
That's the general sort of spiel.
Yeah.
Not the spiel, but floors. You do clinic roughly I think it's every 3 months, 2 months. I said, yeah. And then you do the units. So you're doing ICU. You might do the cardiac ICU as well. So those are as typically not as a first year, but usually as like a third or second year, you'll do like the 24s, depending on the institution. But yeah, it's usually units, floors, and clinic, and then you have your elective time where you can also figure out maybe if you're interested in like cardiology or endocrine, like you can find your time to do things like, not find your time, but again, explore your interests a little bit more and work with your subspecialists. And those are like 9 to 5s. You usually get your weekends. So.
Okay.
Yeah.
Shouldn't like trying to have fun with your patients and stuff like that, especially at the clinic setting. And so I'm a little curious about like what that kind of looks like for you, how you're able to really enjoy some of those moments in clinic.
Yeah, so I think, again, trying to recognize like some things I am sort of inclined to, or some, like your strengths and your weaknesses, right? I think I am somebody who, I'm a pretty charismatic person. So I like, I love to try to connect with people, find some common ground. So I think like that to me is just paramount. Like rapport is so much of internal medicine, or even, I think sometimes people frame it as like, like medicine is also a lot of customer service, whatever you want to call it. But again, like if you don't have buy-in from your patients, or like if you guys aren't really working as a team, or like I'm really, really all about like patient-centered care. Like if somebody's not, comfortable with the plan, and like you're not, and you haven't identified that, or you haven't heard them out, I think that's a recipe for, a lot of the things that we kind of chalk under the word like non-compliance, right? Or like somebody that doesn't want to do things. But I think a lot of times, like if you really get down to it, a lot of times it's because people don't feel heard. And I understand medicine is so fast-paced, so busy. There's so much to be done that it's very hard to even do that. But again, as somebody who's seen both sides of it, again, as seeing like family members not really being heard, or even having other patients just tell me like, they just don't feel, they feel alienated at times. Realizing the importance of that, like that's just never lost on me. So, and I think it just makes my job enjoyable. Like I said, I'm here to take care of people, and I love to put a smile on people's faces. And that's just, for me, that's part of my goal when I go into the room, like to try to laugh with them or just try to relate. And sometimes it's like there's a nice quote that I love. I don't know who, I'm sorry, I don't know where it came from, guys, I'm sorry, but like it's better to be like felt and rather than seen, right? Like if somebody can feel your presence, or like what kind of feeling you give to them, right? Like I always think about that. Like I want them to know that I do care, cause like it's so much easier to get things done, or somebody will want to tell you things, versus when you feel closed off, or when you're coming off as your energy is just not there, or it just feels very, I don't know what the word is, but again, I think if you're not open to them, it's much harder to, it's like pulling teeth. It can be.
Yeah.
But it just part of my job. Like I love to laugh with people. I love to get to know people. Like I love New York. I love talking with New Yorkers about anything, man. Like it's really cool sometimes. Like again, some of my patients, they tell me how they grew up in brownstones, or like in Harlem back in the day, or like I work in the Bronx. Like some dudes talking about like coming up when hip hop was really happening, or being on subways in like the 80s, and like that stuff like means something to me. And like again, I really do love New York, and I love the people here. So that to me, like New York is just, to be here and to live here is just such a unique experience in and of itself. So like that's already, again, that's a pleasure. That's part of my job that I love. And again, I get to take care of really cool, special people. So, yeah, man.
I think a lot of what you said there is huge, you know, so I definitely appreciate you mentioning all that, first of all. I definitely think the aspect of like making sure you're hearing patients is such a crucial thing.
Absolutely.
I think that's something I definitely spent like a lot of time thinking about, and I think it's so important that we kind of have that as like the center and like the forefront of what we're trying to do with medicine. Because I think, just as you gave like with the example of like certain stuff being marked as non-compliant, so I can already imagine for someone who's been in clinical settings as a resident, you probably see that quite a lot, you know, and it makes you just think in terms of whether it's like biases or like being just like very focused on like getting a particular task done as opposed to kind of really caring about the patient. You know, I think we definitely, I'm sure really anyone, you know, going into medicine, including myself and especially those who are physicians, I think probably always have to keep that as a mindset of like, I'm trying to make sure that I'm not just trying to treat this pathology here, but I'm really making sure that I'm keeping that patient in mind.
Yeah, exactly. Because again, people are so multifaceted. People are so multidimensional, and a lot of times, like, we don't have to, but a lot of times we end up flattening somebody, again, like you said, to a pathology, or like, you know, for the purposes of sometimes, like, if you're taking care of however many patients, whether it's 30, 40, 50, sometimes some people are carrying in their minds, like, yes, you do have to simplify things, but you have to realize that's a tool for the moment. And again, like you said, we're remembering why we're even here in the first place. Again, for me, like, I knew I was here to take care of people. And again, people with conditions, obviously people with medical conditions, but I'm here for this person. So, like you said, if somebody's just not being heard, or even like, again, very grateful to Sophie Davis, or CUNY School of Medicine, for the, like, implanting the seed of like the social determinants of health very early on, because it's very true how much like people actually, how much their day-to-day, their lives are actually impacting their health, or like, or even like we were talking about, like your self-talk, like your mentality, like how are you like able to do things, or like your perception of things, right? Like, how do people perceive their health? Like, is this actually important to them? Like, do you know it's important to them? Or, you know, like, I know why it's important to me because I went to school. I have all these justifications, these papers, all that stuff in my head for why somebody should be doing something. But if you don't actually know like what's going on in their lives, like, or their perception of things, like how, like, you know, like it's hard to actually make an assessment, or like actually, again, like take care of them, or to get them to actually do what you want. And like, you know, for some, like, it can just be that they'll take it at face value for that. And then again, for me, that's not, I don't want to necessarily stay there. Like, I want to do, that's just for me. Like, I know that is part of the work that I want to do, I want to bring to my job. And again, I know there's so many people out there that want to do the same thing. So, you know, I'm glad to, again, like, this is why, like, I'm happy to be here, man, because I'm sure a lot of people feel that. And again, it's hard. We get bogged down with so much. There's so much to, like, even right now, like, you're talking about it, like, you have so much going on. You're trying to do something outside of medicine. You're probably trying to take care of yourself, your own mental health. You still have other aspirations outside of this job, or this career, this path. And, you know, you're still probably trying to explore. And, you know, I think as life goes on too, things just get more and more like kind of fuzzy, complicated, and stuff like that. So it's like, you know, it can really take away. And sometimes, like, it's just easy to sort of flatten things out and make things very simple, and not investigate something that's not incentivized. So it was a little roundabout way of saying whatever I had to say, but I think it's very pertinent still.
Yeah, So yeah, it's definitely a lot there. I think
I know. Like,
it's definitely deep. Like, I appreciate you bringing
Yeah.
that aspect up for sure. Let's see. So probably like two more things I do want to ask you. First thing. So you're right now you're a PGY2. You're in internal medicine. You still have a little bit more to go with residency, but ultimately, like, what are some of the goals you have for the future after you kind of get through like, what you're currently doing?
So I'm still, I would say I'm still undifferentiated in a lot of ways. As far as like what I want to do immediately with my career, I probably do not want to specialize. Honestly, I think like the sort of generalist pathway is really what jives with me the most right now. And when I say generalist pathway, I mean like so I would like to do like some inpatient and outpatient medicine. So inpatient being like a hospitalist, which is somebody again who takes care. You're the attending, quote unquote, not quote unquote. You are the attending physician on the floors, right? So I would review the plans with folks who are admitted, and I wouldn't necessarily be a subspecialist. I would be talking with a lot of them, but again, that to me is fine. Like I like, again, some people are not super interested in the social work aspect of things. Again, like for me, again, I know where I come from, and like I know like that isn't too much of a, like I don't mind dealing with that or taking that on, I should say. And then again, outpatient, like I could see myself transitioning to a more outpatient primary care sort of practice when I'm like older in my career.
Yeah.
Because part of me does like, I love everything. Like there wasn't a special, like there wasn't a I just didn't like the idea of just focusing only on one organ system.
Yeah.
I like a little bit of everything, so that's why I can really see myself just sticking with like hospitalist medicine. And on top of that, like again, if I were to do maybe like straight hospitalist, again, like I do like the idea of 7 days on, 7 days off. Like I know the 7 days on will be a little tough, but at the same time, like I also think like my time, I couldn't necessarily put a value on my time per se, and I just liked the idea of, again, I think it's I don't remember exactly what Henry David Thoreau said. I think it's Henry David Thoreau. He just talks about like working for your time, and again, for me that's me thinking of it through a personal lens. But but kind of connecting that all together, I think if you're aligned in what you actually do and you're comfortable in yourself and your own skin, it goes that much, like I think you're able to bring that much more to a patient. When it's so much harder to actually be present, and again to do all the things that you want to do if you're drained, if you're debased, if somebody's like, if you just have other things going on, you won't really be able to do your job to your fullest of it. Like we talk about wellness in medicine and stuff like that, and I feel like, again, I wouldn't call it under, like that's not under the auspice of wellness for me, but that, again, I think they're aligned, or they're similar, right? You have to take care of yourself, and for me, like I know that's part of it, right? Like I know how much better I can, like I'll be. That's the closest to the best version of me I can see, right? Somebody where, like, I do have my time and I will be a full person, because again, like I just said, I love to talk to people, I love to connect with people, and if I can have that much more of a full life, I'll be able to reach somebody maybe in a different way, because I'll have different experiences, and I maybe won't operate from as narrow of a lane or something, and I'll have the energy maybe to extend myself in ways that I possibly couldn't if I were a little bit more bogged down. So that's what I think of as far as like my immediate career. I still think about, like, I still want to do a lot of other things, but I probably do have to narrow some things down, because time is limited, man. Time is limited, and our energy is limited. But I love fitness. Like I love to run. Like I did a little running club thing when I was like in undergrad.
Oh, okay.
Like I used to run with some friends around the block, and this like we not even around the block, like around my old high school.
Oh, okay.
And it's random people started joining. Like they were like, "Oh, you wanna?" They was like, "Oh, you guys show up here. Like, can I join?" I was like, "Okay." And I was like, "Yeah, I think that's something I would probably want to connect with again, or I don't know, even
Yeah.
just more. Like I just want to make sure that again, I know what I am. Like I know who I am, and I know like I just want to leverage, my position in life right now to help others or to amplify like voices that haven't been heard, right? Like I said, I love to teach. I
Yeah.
can mentor other people. It doesn't just have to be towards medicine, but like I used to do the college fair at my school, and
Yeah.
it's like it was cool to even connect with people that way. So I know that's not the end of the road for me, and I know like I to connect with people is huge for me, man. So
Yeah.
yeah.
All right. Yeah. So my battery kind of running out.
Yeah.
So I'm gonna wrap it up soon. Yeah.
You got one more?
So last thing that everyone asks
Yeah.
you for a wrap of the episode. This episode is So I do always try to target just really people who may be interested in ultimately pursuing medicine, like myself, and kind of just be able to give people different tools or different things they can learn. And so I do want to ask you, for anyone listening
Yeah.
that is probably an aspiring physician, what piece of advice would you want to give to them?
Ah, man. Okay. Um, I think. Well, I think just even from this conversation, from to me is finding like really understanding your why, like why you are in medicine. Like it can be a simple reason. Like I said, I knew I wanted to take care of people. I knew what it was to feel something, like to really feel other people, their emotions, or like really where they're at. So whether that was their pain, like I knew like I wanted to take that away, or again as I started to learn more, like the pathophysiology of things, like that was like just to marry those two was like amazing to me, right? And like that really kind of lit, like at each different checkpoint, like kind of seeing like where I was, reflecting on that journey and trying to pull like to contribute more to that why, right? To kind of reignite that sort of inspiration is hard, but I think that's super important. Additionally, like finding your community and finding mentorship, finding people that have potentially already been there, have seen those trials and tribulations, because you don't necessarily have to go the journey alone. We know that, but again, especially in medicine, especially again, like there are folks who are out there who are very willing to give you to put you on the game, to give you the keys, or to let you know the mistakes they've made, and you don't have to necessarily go that alone either.
Yeah.
So and even if you do reach out and you don't necessarily hear back, again, that's not an indictment against you. That's maybe not even an indictment against that person. Everybody again has their own lives, so I think do not it's not rejection, it's redirection. another sort of term we can, or quote we could use, but I think those are some big things. And honestly, like super cliche sometimes, but like meditation or mindfulness, and I'll say this with a little bit of a caveat, like just again to notice your internal, your own self-talk. That's really what it's about sometimes. Like how much are you perseverating, or like how much, like can you notice what, like if you're spiraling maybe. And I don't mean that in a negative way a lot of times, but like when certain situations happen, like do you just subconsciously go into that same conversation about maybe beliefs that are not necessarily true, that you've just been holding on to, or insecurities that you may have, and that's okay. That's fine. We're here to heal. We're here to grow as well. So I think cultivating that practice is a life skill that's independent of medicine, but it will still like serve you very, very well. So find some people, try to stay in touch with yourself, um, and just try to remember your why. Hold on to that and build on it. That's what I got for y'all right now.
All right. Yeah, so definitely appreciate you taking the time. I'll just schedule you to be on the podcast. I definitely feel like a lot of people learned a ton of things from this episode. This entire episode. Definitely leave in the comments, whatever you thought about it, if you felt you learned something, anything like that. If you stuck around for this entire episode, definitely hope you enjoyed it. And with all that being said, I'll see you in the next one.